Welcome to It Depends, the podcast for therapists by therapists. I'm your host, Dr. Joy Zelikovsky, and this is the place where nuance lives. Each week, I sit down with a fellow mental health professional to talk about the lessons we wish we knew when we started, the clinical moments that changed us, and the wisdom we carry now. This isn't a how-to, it's not a highlight reel, it's the honest, messy, meaningful conversations we don't always get to have. Whether you're just starting out or decades into the work, you'll find real talk, shared humanity, and space for the questions we all come back to. What's the right answer? Well, it depends. Let's get into it. Our guest today is Libby Parker, a certified eating disorder specialist, author of 4 books, including the acclaimed Permission to Eat, and a matchmaker of sorts, but for connecting people with the right eating disorder treatment. With over a decade as a registered dietitian, a passion for helping college students and theater professionals, and a vibrant background in musical theater herself, Libby brings a unique blend of expertise, creativity, and heart to the conversation. Hello, everybody. Welcome to the It Depends podcast, and I'd like to welcome Libby today. I'm very intentional about not introducing my guests because I like to hear what it is about you that you want us to know.
Okay.
Start
That's a big introduction. Hi, everyone. So I'm Libby Parker. Yeah, and I actually struggle with introducing myself at this point too, because everyone asks like, "Oh, what do you do?" Or, what's your role? And like, I do my best, and I'm pivoting careers-ish, but not. But how I've been putting it is I am a registered dietitian by trade. That's my training. I've worked with eating disorders for about 13 years now. And in the last few years, I have been pivoting into more business development and consulting roles, and I am primarily doing therapeutic consulting for eating disorder placement now, but knowing me, I can never do just one thing. So I also do a lot of speaking engagements. I am the Broadway Dietitian, and I work with performers and particularly doing education for BFA programs and conservatories and dance troupes and things like that. And I write books. I don't know. I do a lot of things, and I have no idea how to put it in an elevator pitch anymore. So that's me in a nutshell.
Well, that's the nice thing. It's a podcast and you have some time, so you don't need an
Yeah.
elevator pitch. You get to take as much time as you like. Did you always have an idea that you wanted to be a dietitian?
Not at all. I feel like this question comes up every podcast because, like, usually people
Right.
are like, "Oh yeah, I knew I wanted to do this for." So I went into college pre-vet. I was going to be an equine veterinarian.
So very different than dietetics.
I mean, the science is still there. Like, I think in high school I wanted to be an equine geneticist. I wanted to like breed racehorses, and like I loved the Punnett squares and all that stuff. Like, I've always been good at science. I wouldn't say I've always been passionate about it, but I've always been good at science. Um, and I started college, and kind of two things were happening simultaneously. On the one hand, I grew up in Minnesota. My first school was in Wisconsin. And so I had the very realistic realization of, do I want to get called out at 3 a.m. in the middle of a blizzard to stick my arm up a horse's butt?
Facts.
No, what can I do with people? What's going to have more normal hours? I didn't want to have a job where I would be on call, and I didn't want to have to go out in weather. So that kind of limited us down. But I'd already gotten a bunch of science prereqs out of the way. I knew I didn't want to be like a doctor or nurse or anything like that.
Because you have to go out at 3 a.m. and stick something up someone's butt or take
Well,
something.
yeah, like,
Not your jam.
yeah, now we'll get to this probably later, but like, God, I could never work in a hospital. Oh my God, no. So at the same time all of this was happening, unbeknownst to me or really anyone, I had an eating disorder going on. So of course, like many of you that probably listen to this, because I know Joy is eating disorder provider as well, I was obsessed with nutrition. I was reading all the nutrition facts labels. I was reading all the women's magazine articles. I was like, cool, I got this weight loss thing down. And so that naturally leads to a career in nutrition, of course.
Or
So
therapy. It's one or the other.
yeah,
Yeah.
yeah, I was so on the like food and science and like there has to be a way to have a perfect diet, and so I switched majors, which also required switching schools because my school didn't have a nutrition major. So went over and did that. And I will say that in terms of my health and life, that was the best thing that could have happened, because I am so scientifically minded that by the end of undergrad, I had behaviorally worked myself out of the eating disorder because I was learning how the human body actually works. Like, oh, we actually do need this many calories a day to survive. Oh, sugar isn't evil. It's going to break down the same way from an apple or a cookie into your body. And like, that all really clicked with me. And I had amazing professors. I did go on and do more therapy afterwards, and the body image piece came later. But yeah, that it probably saved my life to do that major. And yet, if I were to go back and do it all over again, I would probably choose a different major, because I'm just not as passionate about it anymore like I was for several years. And I don't know, there's so many things. You heard from my introduction, I want to do all the things. So
Well, so many thoughts. I guess my first question is, did you ever label it as an eating disorder for yourself while you were going through that process?
no, and I was strictly in the denial phase through the whole thing. I knew a lot of what I was doing was not normal, and yet, like most of our clients, I was able to justify it. And for the sake of this, I won't go into habits and all the things that I did. I don't feel like that's
I
what
get.
we're here for. But I never got officially diagnosed.
Okay.
My parents, because my aunt who saw me 1 to 2 times a year, is like, said to my dad, oh my gosh, she's lost so much weight, like I bet she has an eating disorder. So they didn't know what they were doing. My whole family, no one's been to therapy, right? So they're stoic Midwesterners. We don't talk about our feelings. So they sent me for one session with a therapist who, I'm sure looking back, had no clue about eating disorders whatsoever. And in that session, I was able to convince her that I did not have an eating disorder, and I had her write a letter to my parents that I never got to see. She sealed it and signed it and all that, telling them that I did not have an eating disorder, or whatever she wrote in it, they got off my back. So I never went back to therapy with them, and I never got diagnosed. So it was really good that I had such great professors, because, I was one of those people that I had the idiopathic high cholesterol despite that I was eating so clean. I think there was times where I definitely had orthorexia going on. I was definitely restrictive. I feel like now I would probably have diagnosed myself with anorexia. It was, we were still in the DSM-4, and so like I never missed my period. And so it's like, I don't have an eating disorder.
When did it click for you? Like that shit moment where you're like, oh, whoops.
I never had like a big revelatory moment. There wasn't like oh my God, I can't believe I've been doing. I think it was more just like a gradual knowing of like, this is not good. We should probably do something about it. And I think both in terms of how the eating disorder kind of ramped on, it also slowly ramped off. So I never went like 0 to 100 on anything. I was very much not an all or nothing person, which was great, because like in my disorder, I would still eat like brownies and things too. And like, I also, as I was especially learning, like I can distinctly recall, even in my second year of college, I had taken like basic nutrition class, and I was like, I know I need to eat a certain amount of calories just to stay alive. And so I didn't let myself go below that. I had a high, I had an
Mhm.
upper cap too, but I had like
Right.
this range that I required myself to stay in, because I was, of course, a calorie counter. But I very, very rarely went below the minimum that I had set for myself, which was enough to maintain body function. Maybe not for my exercise level, but like it was,
Right.
clinically appropriate for maintaining my body systems, I guess.
So it ended up serving as a protective factor because it
Yes.
allowed you probably to stay in a place where you weren't as compromised as you could have been, which
Mm-hmm.
also allowed you to flow out of it a little bit easier.
Yeah. So I definitely knew those people that did take it all the way to the extreme, and,
Mhm.
did, go days without eating or whatever. And it's like, I never, like, I was always one of those people that was, despite, um, not wanting to eat, I was always excited to eat. And I was always like, of course, I'm going to have my 3 meals. Like, I might not go get ice cream with you, but I'm going to eat. Like, I can't skip meals or days. Like, I was never that person.
Right. So then you never had an eating disorder because when you were eating.
Yeah, because I ate. If you can't see us, we are doing air quotes here.
Yes. No, it's not funny, but I also think about my own educational experience.
Mhm.
And I didn't realize I had a math learning disability until I was learning how to do assessments. And, we had to practice on each other
Mhm.
before we were released into the wild. And I had this moment where I was like, shit, there's a discrepancy between, like, a significant discrepancy between my scores. And, lo and behold, here we go. And then it explains so much. And it sounds like yours wasn't as much of an aha moment as like the slow understanding of,
Mm-hmm.
okay, some of these things were really problematic.
Yeah, I think it was more of I could kind of piecemeal out problematic stuff. As I learned, is like, oh, this new thing I learned today, that's something I'm not doing right in my life. Let's maybe do something about that. But these other five things, they're fine. So it was kind of as I learned, I slowly did better. It wasn't like I learned something one day and like, boom, I'm going to change my life. It took some time, but it was, I think, kind of that like gentle knowing of I trust science. And when there's this many things telling me something is true, I have to believe it, especially like I loathe doing labs, but like as we were doing the labs and like learning biochemistry and all that stuff, it was like, okay, as much as this is not my favorite area of study, like it makes sense and it is kind of there in black and white, similar. Like I'm not good at math either, but like math you can't argue with. It is very black and white. Like you either get the right number or the wrong number. And I feel like, science, there's an art to it as well, but like there is definite
There's rules and there's
there's
answers.
rules, yeah, and there's like true outcomes, and you can replicate a study enough times that you can have pretty good certainty in something.
Mhm.
So when like especially as we get like more and more data points about something, it's like, okay, I can't say I'm the exception to that. It's not probable. I'm not, I never thought I was like so special that I was the exception to the rule.
I'm just reflecting on the dangers of the lack of science literacy we are now
Mm-hmm.
kind of encountering as a culture. And
Oh my gosh.
I thought about it in a number of different ways, but I've never really thought about it in the context of an eating disorder. And many of us, I think, are very science heavy in our work with clients because we're like, well, here's the facts,
Mm-hmm.
here's the reality of what's happening to your body or whatever. And I wonder how this will impact us as a field.
Yeah. I mean, science literacy is one of the biggest things I push for with everyone. So I also teach at a college, and in every class that I teach, I spend at least one class session and like we do follow up on it on essentially scientific literacy, like how specifically like how to try to suss out if a source is
Mm,
legitimate or not. If you're looking at something sensationalized like, you know, 95% of participants
yeah.
lost 20 pounds in 2 weeks. And you're like, oh my goodness, that sounds amazing. And then I'm like, okay, class, look at who did the study. Is there any bias there? What was the N number, the number of subjects? Oh, there was five. Okay, that's not a very big study. Oh, they were all really healthy men. Okay, so there's no diversity in there. There's maybe not people that are like you, and they were in an isolation of they were only able to do, like there's so many confounding factors to this that teaching people that like, okay, we want large study numbers, we want a randomized control trial, want, we want all these different things in order for something to be considered like good research. And so when you see a headline, don't just take that at face value, especially nowadays. Oh my goodness, that's not just science, like everything. Like, look at your sources here. But
Yes.
really, yeah, looking at who is putting this out there and what is the actual information behind it. You don't have to know statistics, you don't have to understand all of the words, but you can look for a few key things to see like, is something legitimate?
We do the same exact thing in all of my classes. We get an
Mm-hmm.
article and we start to just pick it apart. And it started actually from I saw someone do a summary of the article in Psych Today, and it made me so angry because I was like, this is so misleading that I brought it into class. And I was like, here's the article from Psych Today, and here's the actual article. So let's go through and see if this is a study that sort of just makes sense. And whether or not it is, does the title and the article in Psych Today reflect what the actual research article is saying? Of course.
Mm.
But yeah,
Yeah,
it's
and it's these sources that we trust. Like, I think of Psychology Today as a pretty legitimate source.
and they didn't actually say anything wrong. It was just misleading. It was a title to catch your
Mhm.
attention. If something about junk food and like if you eat junk food for 2 weeks, it'll change your brain chemistry. Right. Which is based off of one study with low
Mhm.
sample size. What they considered junk food was actually just like normal snacks for a lot of people. Like when my students were going through it, they're like, this is what I eat in like a normal day. So what but that was the sensationalized headline.
Yeah. That reminds me of a student that I had many years ago when I was teaching in person. And I swear to you, he hasn't, or had, I don't know him anymore. He had an eating disorder and it was pretty bad. And he was
Mhm.
a fruitarian. And he spent pretty much the whole semester trying to convince me that what he was doing was not only right, but how we should be eating, and that the World Health Organization was wrong for like their amount of protein we should have or something. And so, and I would gently debate him like after class and stuff because I was like, I don't want to take up time during class. And he was one of those frustrating students too, where he knew how to test well. So he was getting straight A's and everything. And he's probably a dietitian now, which terrifies me because he was just like he could do enough to pass the tests and
He was
everything, and
insane.
he could BS it, but he didn't believe any of it. So I remember I wanted to be a good teacher and hear him out, so he borrowed me this book that he was following, and if anyone's listening, it was the 80-10-10 diet, something like that. And the whole premise was that I mean, truly a plant-based diet, but particularly fruit and just vegetables and like very limited on nuts, beans, all that kind of stuff, you could meet all of your nutritional needs. And it was this like chiropractor who wrote the book. And so I reading on, and this is where like you need to use your logical brain because again, the as I'm reading this book, I'm like, this doesn't make sense. But
Right.
then I would look at the citations in the book and they were very legitimate sources. And so I started doing some comparison in there as well, like it sounds you did with the Psychology Today article. Like there was this table of the percentage of protein in vegetables. And I just remember this one for some reason. It said asparagus was like 29% protein. And I'm like, that does not sound at all right. Like if that was
It was
true, then
water.
we would be getting a lot more protein in
Carrot.
our diet. And it was just like this whole list of vegetables and like how much protein they had. And the citation for it was, I think it was a USDA. And so I'm like, okay, like that's a very research,
Yeah.
especially when this was written, very research funded, like should be legit. So I went to the source and I looked at the direct article or whatever that source came from. And the author had done his math wrong by a factor of 100. So everything was correct, but it should have been 2.9%, not 29%, for instance. And he did the whole table that way. So legit source, legit information, author knowingly or unknowingly did the math wrong, tweaked it. And so that prompted me, it's like, okay, are other people finding this? Like I only made it like 2 chapters in this book because it was so infuriating. And I was Googling it and I ended up in this forum of people talking about this book, and they had all found similar things. They found that one, they found like throughout the entire book, it was like, yeah, he's using these sources and then he's totally conflating the data to do whatever he wants it to do. So he's like listing these really good studies and then just taking whatever he wants out of it, out of context. So you really
There's
have to watch what's out there.
there's like groups of people that I don't know if it's professionally or just on their free time will go through books and articles like this and just like, is it what it says it is?
Mm-hmm. We need more people doing that. I don't want to. It's so frustrating, but
It's
like I
tedious.
needed to prove to the students like I had like it was a personal thing for me with this one, but man, it was exhausting.
Let me guess, it was just like a whoosh over his head when you brought this
I
information
think
up.
so. Yeah.
He's just not in the place
Yeah.
to hear it. That's unfortunate. I genuinely hope he's doing better.
Me too. I really do.
So you give up on horses. You're not a 3 a.m. call out type of person. Fair, very fair. And then you get into nutrition and dietetics. So what was that transition like for you?
Well, the transition from vet and animals to nutrition wasn't big. I mean, I grew up with animals. I always had animals. Like,
Mm.
until I went to college, it was kind of part of my daily life, but I didn't even get into the veterinary studies. I was just taking like all the general
Okay.
sciences
So
and
it was just,
history and like, all
yeah.
those basic classes. So I wasn't even in major classes yet. So it didn't really matter. The only thing that I took like towards veterinary science that I didn't need for nutrition was it was cell and molecular biology. Like we were growing E. coli. I'm like, why?
Oh.
Why do we want to? Aren't we eradicating this stuff? Like I hate labs.
I'm trying to get rid of
Yeah, like, there was I don't know. I can't remember what it was. We were growing something, and I'm like, I'm pretty sure we don't want more of this in the world, and we're growing it. Ew. So I hate labs. And so yeah, so I switched over to nutrition. I don't it's like I blocked a lot of that part of college out of my brain, which is probably because I was malnourished and a lot of it did get blocked out. So yeah, I mean, I came out of undergrad not really knowing what I wanted to do with it. My initial assumption was that I was going to help people lose weight, but I was kind of open to whatever because, we had to go into our internship. And so I went in basically knowing I probably didn't want to do clinical in a hospital, but I didn't really know what I wanted to do. And so that's kind of how I went into that. And then, I mean, some of the kindest things that preceptors said to me were that they really saw me as entrepreneurial and they saw me working with dancers. That was some of the good stuff. And then some of the bad stuff was my first clinical preceptor said that I did not fit the checkbox that is clinical dietitian. I was trying to be too creative. Like I wanted to like talk to them longer and do a, full counseling session and like write up. And she's like, no, you go in there, you do these things, you check the boxes, get out. I'm like, I can't do that.
So I wonder if that's how you kind of made your way over to eating disorders because it does have that component of spending
Oh
the
yeah.
time, a little more talking.
Well, that's why I stay with eating disorders. Honestly, it is seemingly the only legit counseling that dietitians really get to do, and at least in long term, very psych focused. Like I went on and took more psychology classes. I've taken so many counseling classes, got very skilled in like MI and CBT and all of that stuff, which I think every dietitian, my favorite class in all of undergrad was counseling. And I wish we had had 50 of those. And I wish that we were joined up with the psychology degree because no matter what setting a dietitian is in, the goal of nutrition counseling or nutrition, it's medical nutrition therapy,
Mhm.
therapy is in the word, is behavior change. And if you don't understand human psychology, you're not going to get them to change behavior because I mean, this is, I think, one of the questions you had later on, but like, what's one thing that you wish people knew about dietitians? Like, we are not the food police. Like, a dietitian should not be just telling you eat this, don't eat that, or just handing you a meal plan. That is a bad dietitian. Like, we should be working with you on behavior change through a psychological process. Yes, we are the nutrition experts. Yes, we might be trying to nudge you in a certain direction, but we should not be saying, just do this.
Right. And that we know that that never works for
Mm-hmm.
any, like, if they could just do it, they would.
Yeah.
Why
Like,
would they be
so, I
coming?
mean, so many of my clients that I've had, like, they know more about nutrition than I do. Like, they've been in their eating disorder so long, they know everything about every food and they've read every website and package label and everything. And like, if that was enough, they'd be fine. But it's about applying it in everyday life and what really is the motivation for somebody and what fears and triggers and traumas get in the way of how we eat, and that you don't have to have a disorder to have things that get in the way.
This is one of those things that I think is particular to eating disorders and also very tricky to manage because we encourage having a team and the team is
Mm-hmm.
vital. Like we need it. But many of us wear multiple hats and overlap on the
Mm-hmm.
team. And you'll have some folks talk about scope and really staying in your lane. But to some extent, there's an impossibility of that. Like you need,
Yeah.
as a therapist, you need to know about the food. You need to know about the medical. You need to know about the
Mm-hmm.
meds. And I'm not saying you should fill those roles and take
Of
on that
course.
role, but you have to have a basic understanding of it. And sometimes if a client refuses to have people on their team, you end up by default taking on a little bit of that role, whether you want to or not.
Yeah, exactly. I think like just like you said, particularly within the eating disorder world, we have to blur the lines on scope,
Hmm.
if only for harm reduction, because it gets so easy for the clients to split providers. And, depending on who they're more comfortable with talking to, like I've had so many people that don't feel as comfortable with their therapist. And so they tell me everything. And then they go to their therapist's office and say two sentences to them for the whole hour.
And
And so I'm filling them in. I'm like, oh, yeah. And this person was raped. And, like all this. And they're like, what? They never told me. I'm like, yeah, that's why this is going. So you have to have that basic understanding in, outside of your own scope and all of it.
I've had many instances where the client is not working with an eating disorder specialized medical provider.
Mm-hmm.
And I've had to learn to read labs because the
Mm-hmm.
provider is telling them they're fine. And I'm like, I'm seeing some really
Mm-hmm.
troubling things on these labs that I know are consistent with
Mm-hmm.
somebody who's nutritionally struggling with an eating disorder that could lead to something bad. And then it's hard because as the clinician, I'm then trying to explain to the MD why we either need more tests or why they do need to
Mm-hmm.
go to the hospital or whatnot. And again, like how do you're not in your lane in that moment.
Yeah. Yeah. Go on a very long rant about that. I feel like we should move on to something else because yeah.
So I'm wondering, how did you actually get to eating disorders?
Yeah. So it was totally by chance. And then I fell in love with it. So after I did my internship, passed my RD exam, I was applying for work and I was in a very small town, California, about to get married. So I couldn't really move anywhere. And the program I had come out of was in that town. They were like overly saturated with dietitians without enough
Mhm.
jobs. And so the first quote unquote job that I got was actually starting private practice out of a need that came up. So in our local dietetic association, we had the email listserv. They would post jobs, and this young woman was coming up to college in our town and she was struggling with anorexia and relapsing, and she was looking for a dietitian. She had very like specific things she was looking for in a dietitian because she had been working with someone back home. This is, before telehealth and all that. And so I emailed her and I said, hey, I'm new at this, but if you're willing to work with me, I'm willing to work with you. And I had a little bit of eating disorder knowledge prior to this, but I hadn't really seen clients. So this was like
Mhm.
kind of going in blind, and also having the recognition that I had just been through this. And while I hadn't received help, it was like I kind of knew how the brain worked. I didn't know to put it in those words at the time, but like I knew what she was going through mentally. And I also like super lucked out with this case. She was about the closest to a textbook definition of anorexia you could get. Like she had some family stuff, but like without a whole lot else going on.
Right.
Like as far as eating disorder clients, like, don't get me wrong, it was still difficult, but it wasn't like she had 5 different mental health diagnoses and like really funky behaviors. It was like very clean, pure anorexia, which sounds horrible, but that's like a good thing.
That's what it was.
But I ended up working with her the whole 4 years she was at college. Her family actually invited me to attend her graduation. I was not able to go, but I was like, oh, it's like I'm sending my own kid off. Like she's made it. She's graduating. But because of her, I was like, oh, I probably should get a business license. And at this time, there was like exactly one book out there on like having a dietitian private practice. And so I went to my local SCORE business association meetings, and I was trying to learn like how do you start a business and get a business license, and like everyone else is doing products. Or like this guy's like building birdhouses to sell, and this person is selling books, and like I'm here like I have to deal with HIPAA compliance. How do I do that? And they're all like, what's that?
That I will say that is the other thing that drives me nuts about training programs for therapists and for dietitians and MDs. They know
They're a
that
business.
so many of us are going to go into private practice at some point, and they offer us nothing as far as basic business, entrepreneurial skills, basic accounting.
Mm-hmm.
That's another thing I tell my students. I'm like,
Oh
listen, if
yeah.
you haven't filled up all your electives yet and you're
business.
this is even a glimmer for you, you might want to consider like a basic business class.
Yeah, I would recommend that. I'm now starting MBA program, and like business has become such a passion of mine through all of this, and it's like all the things I wish I had known before that I learned through millions of webinars and books over the years. Like, man, it would have been nice to have that in the beginning because I made so many mistakes, threw money away.
Yeah. So what is pushing you towards business now? What excites you about it?
I think I really, I love my clients and I love the work that I got to do. And I was incredibly passionate for many years there. In California, I had my private practice, which turned into a group practice for 10 years. And I was all in. I had, other contract jobs along the way, but my business was my baby. Went to sleep thinking about it. I would spend 12 hours a day on it. I loved it. I lived and breathed my clients. I remember asking my then husband, like, oh, this one, like, not doing well. Can we bring her home and keep her in our spare room and feed her? And I'm like, oh, that's, it was my total passion. And I think a couple things have contributed to kind of the shift. One of which being burnout, which I feel like a lot of people are talking about a lot more. When you're seeing, I was seeing people that were far more acute than they should be for outpatient just due to lack of resources in that area. Now that I live in New York, there's a lot more resources. But, among burnout from that and then dealing with my own personal stuff, like it just got to be too much and I wasn't giving my best self. And that's when I knew I needed to really make a shift. And so in order to move out to New York amidst divorce, I needed to get a full-time job. And so I was applying as a dietitian. And, I already knew this, like dietitian jobs don't pay well. They literally don't. And I didn't really want to work as a dietitian for someone else. Like I was applying for all the treatment centers. I was in final interviews for some. I would have done well, but I had someone take a chance on me in a business development role for a treatment center. And I didn't even know that that was something that I was like qualified for. Because again, I didn't have a business and marketing background, but I had been doing it for 10 years. And that was such a godsend. I found this like joy in doing marketing and being kind of the liaison to get the client to the care. And then I didn't have to do the care. And that was kind of nice. It was like, oh my gosh, I get to talk clinician to clinician with these other people, help get people into care, usually taking people out for coffee or a yummy dinner or something. And I don't have to treat the client. Like it was very joyful. So I loved that. So there's, that piece, and that's kind of the career direction I'm still working in, trying to work in. But on the business side, especially as I hired other clinicians into my group practice, I was doing so much more of, as we all do, more of the admin, employee management, marketings. Like my mentor, who had like taught dietitians private practice, like when you have a group practice, you're the rainmaker. Like she always said, like, I'm pimping out my girls, she's like, you got to find the clients. And so I really got excited about all the business stuff. I was in all of these like women's entrepreneurship masterminds and things, and was finding it was so much more creative. Like I could do all the branding and I could do funny marketing quips. And I was getting out and talking to people. And, as a former actress too, like I got to do a lot more speaking engagements, especially after I published a book. And so it really allowed me to feel, oh, this is like my therapy now. Like it allowed me to feel more important. Because, there's thousands of dietitians doing great work, but I think the ones that you notice and the people that get more referrals are the ones that are putting themselves out there more. So I was really loving all that. I was really loving working with my employees and doing a lot of training, because two of them had been my interns that I stepped up into paid roles. And it was just, a lot of great mentorship, and it was really fun. So I loved all of that business stuff. I taught myself like some basic coding. It was like, it was such a creative outlet to like run a business. So I don't know where I'm going with all this. It was a different type of joy.
I resonate a lot with what you're talking about, because I also own a group practice. And I love clients. I don't know that I'd ever want to stop working with clients, but I really enjoy the marketing. Like like you said, developing the brand and going over the logos and thinking of things and ways to market it. I enjoy managing and supervising other people. There's something really special about helping other clinicians grow. And I've also considered doing like the outreach piece. That's my retirement plan.
Mm-hmm.
I would love to just like bop around doing
Yeah.
exactly what you were doing.
I mean, it's far more stressful than I made it sound there, but like
Yeah.
it's a good job.
But it's interesting again how I find that there's, at least in the therapy world, there's sort of like two types of folks. One who are like, I just want to see clients. I don't want to be bothered with any of the
Mm-hmm.
business stuff. And then on the other hand, there's the people who are like, I really like being a jack of all trades. Like I like, which is probably why so many of us are attracted to eating disorder work too, because
Yeah.
it's inherently that type of field.
Yeah, there's no two clients or days that are the same. Like you notice patterns, obviously. There are certain things you do, but you get to be a detective with every client, and I think that's really fun.
Yes, you put the puzzle pieces
Mm-hmm.
together to make their unique puzzle. Do you ever think about opening another group?
I do. I haven't closed my business. I recently, as of the last couple of months, stopped taking individual clients for nutrition counseling, and I'm doing therapeutic consulting and placement, which is a whole new skill set I'm learning. But that's been, another cool way to like use all of the knowledge that I've gained in the eating disorder work in a new way. And I think it's, again, kind of satisfying that creative itch in my brain, even though it is still very like regimented and clinical in a sense. And like there's a lot of like red tape with I feel like it is much more complex to do than private practice. But I definitely think about having some sort of group business, whether that is having some dietitians under me again or I don't know. I've always pictured myself running a large company, and it used to be like having a really large group practice, like, I don't know, 20 dietitians under me or something, plus some admin and all of that. And like having a beautiful office space like you see in the movies. Like that was the dream for a long time. And now I think perhaps because this is what makes me sad for both of our industries here is that the rise of these like huge conglomerate telehealth platforms. So on the dietitian side, I know so many of these clinicians and I know the founders of some of these companies and they're all amazing. Like I don't have any problem with that, but it's places like Nourish and Berry Street and Faye, and there's so many other ones for dietitians that even a lot of these dietitians have other private practices, but everyone is kind of going through these now that we're not seeing a lot of the individualization of what practices can look like and what specialties can look like. It feels to me, if you're the patient going in, it's like you're going to see a new PCP provider and you don't know who you're going to get. Your insurance just says, go to this office and they'll
Right.
set you up with somebody. It kind of feels like that. It feels like less personal and it's much simpler to get started, which, to the thing of a lot of clinicians, like they just want to see clients. They don't want to deal with any of the business stuff. They don't want to deal with billing. I get it. And that's what these companies make really, really simple. Like if you haven't started a business, I mean, if I were starting from scratch today, I'd never had a business, didn't know anything about it, didn't have one set up, I probably would do it because you don't have to pay for your EHR platform. You don't have to pay to get credentialed with insurance. You don't have to worry about the billing. Like you literally set your hours and you log in and see clients and you chart and you're done. That said, it takes a lot of that individuality out of it. All that to say, I don't know that I would have a dietitian practice again if these are still around because I feel like the market's a little bit saturated with how to get people. I don't know what the big business goal is right now as I'm just kind of in this pivot phase. I'm excited to see what happens. I will always have my own business in some sense. I just don't know what that looks like 5-10 years from now.
This September, a first of its kind event is bringing together professionals who understand the intersection of eating disorders and Jewish identity. Introducing the inaugural JED Pro Conference, the Jewish Eating Disorder Professionals Conference, happening virtually on September 5th. Join clinicians, dietitians, educators, and researchers from across the country for a day of insight, connection, and culture-informed care. Whether you're Jewish, work with Jewish clients, or want to deepen your understanding of faith and identity in the eating disorder treatment, this conference is for you. with expert-led presentations, community discussions, and a shared mission to improve outcomes in the eating disorder care. This is more than a conference, it's a moment. Registration is now open at jewisheatingdisorderprofessionals.org. I'm excited for you. I think it's such a cool, and imagine as anxiety provoking as it is to not know what the next steps are. It is also really fun to be like, well, that leaves anything open. You mentioned
More on the anxiety side, but yes.
you mentioned your book a couple times, and I remember buying it immediately when I met you. I was like, book? But tell us about your book.
Yeah, so I have a couple books, but my main one, my baby, is Permission to Eat, a practical guide to working yourself out of an eating disorder during college while celebrating the awesomeness that is you. And I like to describe it as kind of you are a badass style of writing with more science thrown in. If anyone's read those books, I kind of relate to how that author wrote it. And so I threw in, how a little more science and some more personal stories from other people, not just me. But it really is kind of it falls in the self-help category. It's to help people who are struggling with an eating disorder to work through their stuff. And it goes kind of, I specifically wrote it in small, easy to read chunks for people who are struggling with the ability to concentrate and focus on things for long periods of time. It's not a textbook. You don't need to read a whole chapter to get something. You can read a couple pages and you'll get something. Yeah, I have that. And then I published the workbook to go along with it.
Yeah.
So people can get that. And all of the journal prompts and activities that are in the original book are in it with space to write and everything. Plus there's additional activities that were not in the original book. And these are all things that I've used with my clients. So it's a nice little add on there. And then I've got a couple more books in the works. I just need time to sit down and work on them, the motivation to work on them. But
always.
Yeah.
So I'm just wondering, who's the perfect person for the book and the workbook?
I would say I did really write it for the college age population, but I've had people from 15 to in their 50s read it and get something out of it and really say wonderful things. So it is more widely applicable, but I would say the people that I get the most comments from or emails saying, oh my God, your book saved my life kind of things, which I love those. If anyone out here is listening and you've read my book, if you liked it, please, it really brightens my day to see those. The majority have been female identifying college, young adult age, orally, I think leaning towards restrictive bulimia, but the book really covers all of the things. Actually, a lot of people with orthorexia reach out, including, I'm sure he's fine with it because he wrote about it in his book, so I'll mention Jason Wood, who you may know as Orthorexia Bites on Instagram and things like that. He wrote the book Starving for Survival. He emailed me after or while he was reading my book, and it was what made him realize that he had orthorexia, and it got him to read up more on it, go find a therapist, seek help for this, get officially diagnosed, and eventually get better. And now he works as a huge advocate for the eating disorder community and especially males with eating disorders and helping them identify what's going on and that it's not just a girl's disease or whatever. And I'm so proud of what he's doing, and I'm proud of myself that I could be the person that helped him in his healing journey. I'm by far not the most important or only person in that part of it, but the fact that I could plant a seed that allowed him to get help. So yeah, I get a lot of people with orthorexia that got that out of that book.
I think it's cool too, because so many of us see the work that we do as one-on-one, but when you're teaching, when you're supervising, when you're writing and publishing books, you're reaching so many more people and you don't have that intimate relationship with them. So those emails, I'm sure, are really heartwarming and also I don't even know you and I've managed to impact your life in a very significant way.
Yeah. So to all listeners out there, if you have books or authors that you love, tell the authors. We don't know who's reading our books. We don't know who's buying them. We don't know if people like them or they read 3 pages and throw it in the trash. If you like it, please tell us, because we have, little egos here too. I don't know, it's the actress in me is I need external validation, please. But I'm sure pretty much any creative, whether that's an artist, an author, playwright, actor, and I would go as far as your clinicians as well. Like, we like feedback. We like knowing if we made a difference. And that could be, I've had clients that, we were doing good work and things were going well. And they're like, okay, I'm done. Yeah, never. And then like a year, 2 years later, they'll text me, you're never going to believe this happened. It'll be like something that I know because I worked with them so intimately, like is a really big deal. Like, like they
Yes.
got their period back or they ate cake at their wedding or, like something that's like meaningful. And it's like, I'm so thankful you remembered to tell me that even after all this time, because I'm more excited for you than probably anyone else in your life is.
Those emails and texts are such an amazing surprise. Like every
Mm-hmm.
once in a while, I'll get something from a client and they're like, you probably don't remember me. And I'm like, probably do. But,
Yeah,
and
probably
then
do.
they go into this whole thing and life is going well. Or it's really challenging, but they reached out and, they
Mm-hmm.
asked for support and those like make it all worth it.
Yeah.
So tell me a little bit about your work specifically as the Broadway dietitian.
Yeah. I need to wrap my brain around this. Hang on. So the Broadway dietitian really started out of just giving information to fellow castmates. So I grew up doing dance and musical theater. When I was living in California, I was doing a lot of community theater. I came out and auditioned for Broadway a couple of times right before the pandemic. Like I was really like pursuing it in a non-professional way, if that makes sense. It was more of a like, I'm not going to, say that like I'm going for Broadway, but like if something happens, I won't say no. I can take a break from my business, but it was much more of like a passionate hobby. But because of that, a lot of my friends in community theater, they knew I was a dietitian. I think a lot of them respected me, some I know didn't. They're like, oh, the nutritionist. But, they would ask because it was community theater. Like we had day jobs or people were in school and then we'd have rehearsal at night. And so for those that don't know community theater, typically, and this is what it was like in our town, you'd be, working or going to school during the day. And then rehearsals would often start sometime 5:30, 6:30 at night, and then they usually would go until about 11 p.m. Then you'd go
Oh
home
my
and sleep
God.
and get up and do it all over again. And then weekends, usually at least one weekend day, you would have like an 8-hour rehearsal day. Kind of depends on the show. Some of them, if like I did a lot of musicals, so we had longer rehearsals because of the dances. Straight plays maybe wouldn't have that long of rehearsals, but it was still very frequent. It would still be a lot of late nights and a lot of
Spend a
people,
lot of time with these people.
yeah, you spend a lot of time with these people. And, for a lot of people, especially working more traditional 9 to 5 jobs, they're often coming straight from work to rehearsal. So I was getting questions like, is it better to, if I'm coming straight from work to rehearsal and I don't have time to like get a good dinner or swing by home or whatever, is it better to not eat and eat when I get home at like 11 p.m.? Or is it better to grab McDonald's on the way or something like that? And so I was answering all these questions and like giving people tips on like, okay, like here's how we're going to keep up our energy during these long rehearsals. Here's kind of like snacks to pack and, we don't want to starve and, all this kind of stuff. So I was answering those questions and I'm like, oh, like, as a kind of an extension of my business, like, why don't I make this into a blog? So the Broadway Dietitian started as a blog for theater folks. And my first ones were on like eating right for Tech Week and working with your costumers when you have an eating disorder and you don't want to know your size and you're like worried about costumes.
I've never thought about that.
Yeah, like particularly in community theater where there isn't a budget for like custom made costumes, it's very, I don't want to say body shaming. Like, if you have nice people, they're not going to be like, oh my God, like none of these fit you or what, but it's hard to get things that fit. I frequently would get stuffed into costumes that were too small for me because they were what they needed for the show to the point that things would rip. I remember when I did Anything Goes, I was one of the angels and we had to wear these little flapper dresses for one of the numbers. I mean, you know me. I'm not a large person, but compared to all of these like high school girls, I guess I was, they only had a limited amount of these little flapper dresses in their storage that, you just keep recycling the same costumes for like 30 years before you get new ones. And the dress they wanted me in would not zip up. And since it was black, what they did is they had me wear a black leotard under it. And every day I would get safety pinned into this before the number. It would rip at my leotard because we're dancing like crazy. And then I would have to have someone take all the safety pins out so I could get out of it and rush back on for the next number. And no one else had to do that. Like they all just like threw their little dresses over their heads and ran out there. And so that was like one of the biggest body shaming moments for me, knowing that I'm not a large bodied person and still having that experience. So I wanted to write about that and talk about like how to have these conversations. I worked with like amazing costumers who were like, I could say like, I don't want to know my measurements when they pull out the measuring tape, or, be very like, hey, I need a supportive bra to fit under this. And like having those conversations, I think a lot of people, especially new to the industry, are not comfortable having those conversations. They're like, whatever you need me to do, like,
Right.
I'll do whatever because I'm so grateful to be here. And it's like, no, you need to feel comfortable on stage so that you're confident enough to pull off your role.
They
And
know that they can have this conversation, that there's
yeah,
bounds.
yeah. So that was probably the article, at least that I'm most proud of, but I think a lot of people connected with that because no one was really writing about that. And so out of that, to kind of speed this along, I created an online course. I think it's my first online course called Whole Health for Performers. And it was like kind of a quick crash course in literally like a health class for performing artists. And it went through everything from, you know, fueling, and it wasn't eating disorder specific. It was like how to fuel yourself well for long rehearsals and show days and avoiding bloat and digestive issues on stage, to talking a little bit about mental health and when to seek help, to talking about drug and alcohol abuse in the theater world. And again, like when to seek help for that, we touched on eating disorders. I also was a former personal trainer and group fitness instructor and spinning instructor. So I talked a lot about physical health and cross training and rest days and how to like actually take care of your instrument for that. I talked about vocal health and what kinds of ways you can hydrate and types of foods to be eating to maintain vocal health. And I was using a lot of anecdotes from my personal experience, such as when I went into the first stages of heat stroke during dress rehearsal of a show, and remembering like from my dietitian training and working in corporate wellness for nuclear operators who were in sometimes really crazy heat conditions. I was like, oh, I'm starting to have heat stroke. And so I knew what to do. And so I was like telling my cast members, like, you get me water, you go get me a wet, cold paper towel to put on my back, and I figured out, spoiler, you need to get the course to like learn about this, but I figured out, what to do to make sure that that did not happen on stage again, and how to like really take care of my body in a way that I could successfully make it through this very intense, very hot show. Like I was having like layers of costumes and dancing under hot stage light because I had to do these quick changes. So I couldn't like take something fully off, put something
Right.
on. And I had like wool coats on. It was, August, and I got wool coats on over 3 layers of costumes with heat.
Sounds
And
really miserable.
yeah, I mean, it was my favorite show I've ever done, but I had to be very conscious of how I was taking care of my body to do well in that. I could have ended up in the hospital if I did not take care of myself. And it wasn't that, oh, I wasn't eating or I wasn't drinking. It was like, it was just such a specific thing that I needed to make sure that I was hydrating in a specific way and getting electrolytes and like using intermission appropriately to make sure I could make it through this whole show.
Right. Which for those of us who are not in any of those activities, um, that we're not even going to think about them.
Yeah.
We have an appearance.
Yep.
Speaking of the star of the show,
Of course. Pictures are all over.
for those who are listening, my dog just entered the video.
So cute. So yeah, the Broadway Dietitian kind of grew from there. So I started getting on particularly a lot of podcasts and YouTube channels with other mental health and wellness folks in the theater space who were like, we don't know any other dietitians doing this. I was really marrying sports nutrition and eating disorder, weight inclusive work, theater and dance in a way that hadn't really been done before. Like there's a lot
Right.
of dancer dietitians that, do a wonderful job with eating disorders, but there isn't any sports nutrition research really out there. And I dug quite a bit. I'm writing my own book on it, actually. There really isn't a lot of sports nutrition information out there on working with actors and musical theater performers. And so I was taking my insider knowledge of that and kind of putting them together. And that led me to do speaking engagements at a lot of bachelors of fine arts in theater, musical theater, and acting and stage production at many, many colleges throughout the US now. And it's one of my favorite things. I have a signature talk called Weight Inclusive Nutrition for Theatrical Students. And it's inclusive of all the people who work in tech as well, because a lot of the universities combine those for certain classes.
Right.
So they get a quick little nutrition class for their sport. And I absolutely love doing it. And I really want to turn it into a health curriculum for colleges.
That'd be amazing. Because I think even though it is quite obvious that dance and theater and all those things are sports, we don't
Mm-hmm.
think about it in that way. And so
Yeah.
they just get left out of all of that information.
Yeah, I think of it, I think a lot of people do understand dance as a sport, but then
Mhm.
you throw on acting and some makeup and they're like, "Oh, isn't a sport? Like you're doing play practice, right?" And it's like, dang, these triple threats like have to be quadruple threats, and like it's insane what they put their bodies through. And even those that aren't dancing, like the vocal health, the stage lights, the stamina, the mental piece of all of this, there's so much to it. And I often liken it to, you can have a soccer player and a musical theater I call them theater athletes. And let's say they've got an intense show and they're putting out the same amount of energy, they're putting the same intensity. And I don't know a ton about soccer, but like they have periods where they're on the field running and then they have time off and then they're back. And so it's kind of similar, like, okay, we're in the first act and then we have an intermission and then we're back on. So if we say that they're putting out the same amount of energy, okay, so we can think about it in terms of sports nutrition like that. But the soccer player, they don't need to also be smiling and have their hair and makeup done and, stay in the same size costume for the whole run of the production, versus the person who's on stage, even if they are in pain, they need to have whatever expression they're supposed to be having for that moment. They might need to make themselves cry on stage. I've had to do that. It's very mentally intense to like have to get yourself there. You can't let anything outside influence you. And then, you've also got like the whole costume and everything. And like, if there's any, problems, you need to make it look like it was supposed to happen. And, if you're, and something I think a lot of people don't think about as well, if you're on contract for one of these shows, like let's say you're in a Broadway show, you probably have a 6+ month contract. And within that time, there's not a lot of wiggle room for costume adjustments or new costumes. So you also need to maintain your size more or less throughout that. And that can kind of go in either way if you've got an eating disorder, especially like for those that don't have eating disorders. If all of a sudden your physical activity significantly ramps up because you weren't doing a lot and now you're in this intense dance show, it could be really easy to lose weight, and you need to really be on top of that. If you have an eating disorder or you get really comfortable in the show because like, oh, now I'm working and I'm not working out during the day, and then your weight starts to go up, like you need to have some sort of consistency in there, because they're not going to just make you a new costume because you change sizes.
That makes so much sense.
Yeah.
The only time I think I've seen that conversation really happening, not in the same way you're talking about it, is all the critiques of Lizzo and being
Mm-hmm.
a fat person performing, and the claim that she must be unhealthy because of her size, and
Mm-hmm.
really thinking about, for somebody who is dancing and singing and playing the flute for several hours,
Yeah, she good.
the health level is set on that woman.
Yeah.
And I mean, she's in a different, I think, category because, if her size does
Mm-hmm.
change, then she has a whole team who's going to adjust her
Yeah.
costuming and things like
You
that.
have a superstar like that, you have Beyonce, Taylor Swift, their size could change tomorrow and they can have a new costume because they've got the money and the team for it.
Exactly.
Most productions, even at the top level here, like Broadway is losing money hand over fist. Like they do not have money for new costumes. And that goes doubly for community theater. Like they have negative money. They're in the hole money. Like, so that's something I also like to convey to my clients that are struggling with body image is I mean, if someone needs to weight restore for their eating disorder, like we need to do that. If it's an emergency, I'm going to be like, this is not the time to be acting right now. We need to focus on this. If it's something where we can do harm reduction and like we're going to be working on the foundations of the eating disorder recovery while maintaining your weight on this contract, and then as soon as you're off contract, we're going hardcore, we can do that. But for those that are just like, they're otherwise fine, but they have body image issues, it's more of the casting director chose you at this current size. They like your look right now.
Right.
They're not requesting that you lose 20 pounds. They hired you. They hired you as is, right? So don't go changing, because if you change too much, they might not like that.
Yeah. Yeah. You just things I never would have thought of. Um,
Mm-hmm.
it's been it's really been enlightening to hear it from this perspective because I have tons of clients who are dancers and actors, and it just wouldn't have even occurred to me to think about some of these things.
Yeah, I think it's one of those that you can't teach this or like read this knowledge from a book to apply it. You have to have like been in the shoes. And I think only by particularly performing, but also like I've done a lot of backstage work. I've stage managed, I've seen how the sausage is made. And I specifically have talked to a lot of performers, especially getting into the Broadway dietitian piece of it, to see kind of what everyone's take is and how they interpret a lot of this stuff. And everybody I've talked to, even those that are like full-time professionals in this, are like, nobody ever talked to me about how to eat for this. Like they just, said, are you having a salad? And like just kind of like
Right.
assume that you know what you're supposed to be doing. And then, oh my gosh, I could go on so many rants about this, but like a lot of performers, especially if they aren't working, like a lot of them are now becoming influencers and stuff. And because their body is their marketing material, like they're doing crazy workouts. Sometimes they get looped into selling supplements or, showing off some crazy diet that they're doing. And then everyone else is like, what's this like really big performer? Like this is how they maintain their body. I need to do it too. And it's like, none of you have any like actual knowledge of
Right.
this, but none of them know, like going back to the scientific literacy, none of them know this because none of them were taught this. Like a lot of them didn't even go to like a liberal arts degree where they get that one nutrition class that everyone takes, which is clearly not enough. But a lot of them go, if they're like knowing they're going for theater or dance, they don't go to that kind of college. They go to a conservatory where all they are doing is acting classes, dancing
Right.
classes, business of acting classes. There is no general education. There is no health class. So they're the one, like, they're even more screwed than the ones that get the one sometimes harmful nutrition class that everyone else gets. So I feel like this is an area that's been just severely lacking in knowledge. And so I love teaching classes on this.
It sounds like I have two, not questions, but I guess segments.
Yeah.
The first is I would love to hear where we can find you if we want to.
Yeah. Some of this maybe as everything pivots, some of these may be changing. But right now, my website and Instagram are the Broadway Dietitian. So thebroadwaydietitian.com, Instagram at the Broadway Dietitian. Those are the places where you're going to find the most up-to-date information. I have other Instagrams and Facebooks and everything. Everything will consolidate to those
Right.
basically.
And so I lied. It's actually three things.
Okay.
Is there anything that we didn't talk about that you really want people to know?
Only one thing? So many
Maybe more than
things.
one thing.
I guess the one thing that we didn't really touch on that I would love to just touch on briefly, because it is kind of my new business venture, is the therapeutic consulting. Because that's something I hadn't heard of before someone told me that I'd be really good at it, which
Yeah.
was,
What is therapy
yeah,
consulting?
yeah. So therapeutic consulting is a consultant helping an individual or family get to treatment or care for their condition, kind of broadly speaking.
Mhm.
So we tend to think of educational consultants help with school placements, whether that's a therapeutic school or college or boarding school. Therapeutic consultants can range the gamut of substance use, mental health, eating disorder, treatment, placement. And so I specifically work with eating disorders and have built up my network across the country of treatment programs and providers so that I can help clients and their families find the best care for their needs, because not every, as we've been talking about, like not every program, not every provider
Right.
is the same. There's different strengths and weaknesses. Things are going to fit better with different people. So I call it kind of a trifecta of case management, concierge, and matchmaking services, to help someone find their place. And then I will also do family education. If, say the parents or the spouse are like, I don't know how to talk to my person without irritating them. Like, what should I not say? Or
Right.
what is treatment actually going to look like? What can we expect with this whole process? Because, no one should know what eating disorder treatment is like. Like, it's horrible when people have to know. So I don't
Right.
expect anyone like knows what this process is like. So I really have enjoyed helping families, get their loved one to great care. I've had really great outcomes with my people, and work, with the whole family unit if they want to really understand what's going on and work better together.
Yeah, I think a lot of us don't think about the finding the right fit and how to get access
Mm-hmm.
to resources because as deadly of a disease as this is, there still aren't an abundance of resources out there.
Mm-hmm.
And then for the clinicians, none of that is billable time. So I mean, we do it. We
Mm-hmm.
people up with centers all the time. But when you have the resources to have somebody who can really sit down and figure that out for you, it can make such a massive difference.
Yeah. So my goal is to get out and visit boots on the ground, all the treatment centers. And it's been really eye-opening because, you've places where it's like, oh, like I've heard such great thing, like clinically I agree with everything they're doing. Then you get there like, this is the most depressing place I've ever seen. I would never send anyone here. Or on the flip side, you're like, I don't know, like I don't know what I feel about this. And you get there and like, oh my God, these clinicians are incredible and this campus is beautiful. And I will be sending all of my people here. It's like you don't know until you're there and like really experiencing it. So I try to talk to all of the clinical directors if possible and any other staff that I can. I do try to talk to a dietitian at every site just to, because I know the most about that piece of it, and, see as much as I can experience of like, what is it going to be like for the client?
That's an interesting point too, because I've had this conversation with a few people now that I will not send people where I have not, at the very least, like had coffee with
Mm-hmm.
some of the clinicians there, if
Mm-hmm.
not visited the space. And we have unfortunately seen a lot of traumatic experiences coming out of treatment centers and some really
Yeah.
abusive things as well. And so it's just we can't take it at face value anymore,
Yeah.
which sucks.
And I mean, I think the other piece of that, like having been a clinician for a long time and then having done the business development outreach side of it, I've seen both sides of what that outreach piece looks like.
Mhm.
And it baffles me when treatment centers don't hire clinicians to do their outreach, because you're talking to other clinicians.
Right.
And the I feel like I'm just bashing on people now. I feel like the reps that don't have that clinical talk down, and that's stuff that you can learn. You don't have to be a clinician, but you're always like, why am I talking to you about the program? Like, you don't have the answers for me. You're just giving me some shiny brochures and saying, send your people. You're not giving me the information I actually want to know. So when you can speak to another clinician there, you can get more answers. But I also know like the outreach side of it is marketing, and you have to hope that that person is also ethical in how they're doing that. So, as the clinician like sitting and hearing from these reps when I'm going to have my clients go to them, how much of this is true until I've like seen the place and talked to the clinicians that are going to be working with the clients. Because when I was, working for a treatment center, and I'm not saying this is wrong, because you need to have something to say to people, but we were kind of fed, this is what we say about our programs. And you could question it. Like we were encouraged to go out and visit and question it and all of that stuff. I'm not saying that it was wrong, but if you have a lazy rep, they can just parrot things and not know if it's true or not.
Yeah. And I think in all mental health and in all medical settings, it's really important to be ethical and accurate, but
Mm-hmm.
especially in this one where we're really
Mm-hmm.
talking about life or death scenarios, it needs to hit those check boxes in an important way. So now I have some rapid fire questions for you.
Okay.
They're not actually rapid fire. Take your time with them. And some of them are just like one.
Word association. Okay.
Yeah. I'm going to hold up some ink blots. I want you to go.
Okay. Great.
But what is your favorite metaphor to use with clients?
Ooh. Okay, I have a few, but the one that I used a lot that I hadn't heard anyone else using is especially in outpatient, I think of any sort of meal planning as like scaffolding you put on the house. Like it's not strict,
Mhm.
it's not set in stone. It is, a light scaffolding or tool to help you bridge the gap while you're still building that good foundation for yourself.
Right.
And the scaffolding can come down and we can have more intuitive eating.
I like that. And likewise, if we need more scaffolding, we can always shore it up a little bit better.
Exactly.
I really like that. What's a non-therapy book that shaped you as a clinician? Or non-dietetics, I guess.
Yeah, looking at my stack of books now. I don't know if it shaped me as a clinician, but I will say it shaped my private practice, maybe from more of a marketing stance. So I will go with that. And I'll broadly say any of the books by Mike Michalowicz, but particularly the book Get Different. That one was really amazing for helping me learn how to do marketing. That book encouraged me to make a commercial for my group practice, and that was so much fun. Like I did a spoof on a medication ad, where they talk about like, they had the voiceover of like results vary and may include blah blah blah, and I had all of like the positive things of working with an eating disorder dietitian. It was really cute. So it was a book that really got my creative juices flowing.
That's really cool. That sounds so much fun to make.
Mm-hmm.
And finish this sentence. Dietitians don't talk enough about.
I have to go with I guess the easier answer because there's a couple of things, but psychology, I think that's something within the eating disorder world we do, but I'm in so many just general dietitian Facebook groups and they don't. And I feel like it's something that's really missing.
I think you hit on an important piece with that. And what is one thing you wish clients knew about dietitians?
We're not the food police. And we don't just make meal plans. In fact, most of us don't make meal plans and really hate it.
And this says one word, but you can use many words. But one word to describe your journey as a dietitian.
And I swear,
Yeah, go for it.
fucking dumpster fire. No, that's not fair, but that's kind of where I feel like I am right now. I think a lot of my career was kind of taking leaps of faith, whether it was saying yes to that first client and starting a business without any business knowledge, or bringing on dietitians to work under me, or shifting into the Broadway Dietitian. It was a lot of kind of jump before you're ready.
I like that. And I feel like that should be the name of the podcast, like fucking dumpster fire.
No, that's going to be my autobiography.
I just see like the little raccoon or the dog in the little flaming.
Yeah.
Well, thank you so much for your time and really sharing all your wisdom and experience. It's so cool. A lot of this has been therapist, so it's also really cool to get the dietitian perspective.
Yeah, thank you. This is really fun. And I feel like so many podcasts I'm on, I kind of just have the same story, but we got some different places, and I really had fun with that. I was like, oh, we got to talk about things in different ways than I normally get to talk about them. I loved it.
I mean, like the true therapist to me, right? Like I love to talk to people. I want to know how you got here, why you got here. So this podcast continues to be like a really fun experience for me. Mm-hmm. I don't know if it's something I saw myself doing, but now that we're here, I'm like, I really like this.
Awesome. Well, yeah. I had a lot of fun talking to you.
Well, good. Thank you.